Myocardial infarction, likewise referred to as a cardiac arrest, takes place when blood circulation reduces or quits to a part of the heart, causing damages to the heart muscle. The most typical sign is upper body discomfort or discomfort which might take a trip into the shoulder, arm, back, neck or jaw. Commonly it occurs in the center or left side of the upper body and lasts for greater than a couple of minutes. The discomfort may periodically seem like heartburn. Other symptoms may consist of lack of breath, nausea, really feeling pale, cold sweat or feeling tired. Concerning 30% of people have atypical signs. Women regularly existing without chest discomfort and rather have neck pain, arm pain or really feel exhausted. Among those over 75 years of age, about 5% have had an MI with little or no background of signs and symptoms. An MI might create heart failure, an irregular heartbeat, cardiogenic shock or heart attack. A lot of MIs occur due to coronary artery illness. Danger elements consist of hypertension, smoking cigarettes, diabetic issues, absence of exercise, weight problems, high blood cholesterol, poor diet plan, and excessive alcohol intake, to name a few. The complete blockage of a coronary artery triggered by a tear of an atherosclerotic plaque is typically the underlying device of an MI. MIs are much less commonly brought on by coronary artery convulsions, which might result from the drug, significant emotional tension, as well as severe chili, to name a few. A number of examinations serve to help with a medical diagnosis, consisting of electrocardiograms, blood tests, as well as coronary angiography. An ECG, which is a recording of the heart's electrical activity, might verify in street elevation MI (STEMI) if street elevation exists. Generally used blood examinations include troponin and also less often creatine kinase megabytes. Therapy of an MI is time critical. Pain killers are appropriate immediate therapy for a thought MI. Nitroglycerin or opioids may be used to assist with chest discomfort, nonetheless, they do not boost total results. Supplemental oxygen is recommended in those with reduced oxygen degrees or lack of breath. In a STEMI, therapies attempt to recover blood circulation to the heart and consist of percutaneous coronary intervention, where the arteries are pressed open and possibly stented, or thrombolysis, where the blockage is eliminated using medicines. People that have a non-street elevation heart attack (NSTEMI) are usually taken care of with the blood thinner heparin, with the added use of PCI in those at high risk. In people with clogs of multiple coronary arteries and diabetics issues, coronary artery bypass surgical procedure (CABG) might be suggested instead of angioplasty. After an MI, lifestyle alterations, along with long-term treatment with pain killers, beta blockers, as well as statins, are generally suggested. Worldwide, about 15.9 million heart attacks took place in 2015. More than 3 million people had an street elevation MI, and greater than 4 million had an NSTEMI. STEMIs happen about twice as typically in men as ladies. Regarding 1 million people have an MI annually in the United States. In the established world, the risk of death in those who have actually had a STEMI is about 10%. Rates of MI for a given age have actually lowered internationally between 1990 as well as 2010. In 2011, an MI was among the leading 5 most pricey problems throughout inpatient hospitalizations in the U.S., with an expense of $11.5 billion for 612,000 medical facility remains. These foods reduce your risk of having a heart attack. Apples and pears, garlic, oatmeal, virgin olive oil, nuts and nuts, pure chocolate, berries, grenade, avocado, green tea, red wine. The heart drives blood throughout the body with motions of systole, atrial as well as ventricular contraction, as well as diastole, the leisure of the heart muscular tissue to obtain blood from the tissues. Among the keys to its electric motor power is concentrated in the millimeter synchronization of the heart cavities, 2 upper, appropriate and left room, which send out blood to the lower 2, the right as well as left ventricles, subsequently, responsible for expelling the blood. But it is its 4 thin, practically clear shutoffs, which need to show outright precision, tricuspid and pulmonary on the best side of the heart, mitral and aortic on its left side. The valves need to open and also shut properly. When they do close appropriately they are obstructive, and also when they have not shut appropriately they are incompetent or not enough, clarifies Dr. Makaya. Its primary mission is to allow the blood to pass without oxygen coming from the entire body and that it leaves the heart through the fantastic vessels as well as shows up oxygenated to all edges. They ought to also prevent blood from returning backward. The most vital valves, and the illest, are those on the left side of the heart, the mitral as well as the aortic.